The Dark Side of Modern Medicine. What the Healthcare Industry Isn't Telling You, written by Joseph Hertz. Chapter 1. The Profit Motive Behind Your Treatment. Modern healthcare has evolved into a complex business ecosystem where financial incentives often take precedence over patient outcomes, creating systematic conflicts of interest that shape medical decisions in ways most patients never realize. The transformation of healthcare from a calling, focused on healing, into a profit-driven industry has fundamentally altered how medical care is delivered, researched, and regulated, often to the detriment of those seeking treatment. The fee-for-service model that dominates healthcare reimbursement creates perverse incentives that reward quantity over quality of care. Hospitals and physicians receive payment for each procedure, test, and visit they perform, regardless of whether these interventions actually improve patient health. This system encourages overtreatment, unnecessary procedures, and defensive medicine practices where physicians order excessive tests to protect themselves from potential lawsuits rather than to benefit patients. Pharmaceutical companies invest billions of dollars in developing new medications, but their primary obligation is to shareholders rather than patients. This creates pressure to maximize profits through pricing strategies, patent extensions, and marketing practices that may not align with optimal patient care. The development process prioritizes drugs that can generate substantial revenue over treatments for rare diseases or conditions that primarily affect low-income populations who cannot afford expensive medications. Hospital systems have increasingly consolidated into large corporate entities that operate with business efficiency models borrowed from other industries. While some standardization can improve care quality, the emphasis on productivity metrics, cost reduction, and revenue generation can compromise the time and attention that healthcare providers can dedicate to individual patients. Emergency departments may prioritize quick turnover over thorough evaluation, while primary care physicians face pressure to see more patients in less time. The relationship between medical device manufacturers and healthcare providers involves complex financial arrangements that can influence clinical decision-making. Companies provide research funding, consulting fees, speaking honoraria, and other payments to physicians who use their products. While these relationships can facilitate innovation and education, they also create potential conflicts of interest when physicians must choose between different treatment options or devices for their patients. Insurance companies operate as intermediaries between patients and providers, but their business model depends on collecting premiums while minimizing payouts for medical care.
Sample complete. Ready to continue?